Welcome to Ask the Experts, presented by Salinas Valley Memorial Healthcare System. I'm Claudia Otero. Today's guest is Dr. Joanna Oppenheim. Thank you for being here with us today.
Thank you very much for having me.
Absolutely. Dr. Joanna Oppenheim is board certified in family medicine and diplomat of the American Board of Obesity Medicine. And today you will be providing an overview of the treatment of obesity.
Yes, so I wanted to start by talking about why we treat obesity. And I think there's two classes of diseases that we really are very focused on. The first one are metabolic diseases like diabetes, high blood pressure, prediabetes, high cholesterol. These are diseases that go up as a person carries extra weight. There are also other diseases that are related to the actual weight of carrying extra weight. Things like osteoarthritis of the knee, where this is where the joint of the knee breaks down, and some people have to have a knee replacement. Other diseases that are related to extra weight are things like sleep apnea, where sometimes patients will have extra weight around their neck, causing decreased oxygen to go to their lungs while they're sleeping at night. These are obviously problems, and we know that as a person's BMI goes up or excess weight goes up, the risk of these diseases goes up as well. So I wanted to start by giving a definition of obesity. The one we use the most, and which people will see in many magazines, and you can look up yourself online, is something called a body mass index. And this is a ratio of your height and your weight. And I will show you a slide of this in a second. Typically, a BMI of greater than 30 is considered obese. The other way we can measure obesity is with a body composition analyzer. And this is where you can stand on a machine and this will run a current through you and it can calculate what percentage of fat you have on your body. So what we know is if you measure your waist, and as a woman, your waist circumference is more than 35 inches, or as a man, if your waist circumference is more than 40 inches, we know that you're carrying a lot of extra fat tissue in your intra-abdominal area, which is where the risk of diabetes and heart disease, etc., goes up. So you can do this today and without even measuring your weight and height, know if you are at greater risk for those diseases. So now I'm going to show you a slide of a chart of how you can measure your own body mass index. This is where you would just need to know your height and your weight, and you can go across the chart and then see where you are. A normal body mass index is anywhere from 18.5 to 25. A body mass index between 25 and 30 is considered overweight, and anything above 30 is considered obese. Obesity as a disease was designated by the AMA in 2013, and this was very contentious. A lot of people who trained early on and many years ago, like myself, were taught that obesity is related to a person not having enough willpower, not doing the right things by their lifestyle. What we know is that obesity is very complicated to treat, and it's not as simple as that. The nice thing about having obesity designated as a disease, it does shift the perspective for healthcare providers to understand that obesity is not just a lack of willpower or a lack of discipline. 42% of adult Americans are considered obese. In the 1970s, that percentage was just above 10. So this is a big problem for us in this country and around the world in developed countries. We also know that children have a higher obesity rate now. When you look at children between the ages of 2 and 19, that obesity rate is 20% and unfortunately rising. This is a problem for us because as children carry extra weight at a younger age, they are at higher risk for developing those metabolic diseases that I had discussed earlier, also at a younger age, which sets them up for a lifetime of chronic diseases. And we see this, unfortunately, in a higher diagnosis rate of diabetes in young adults as well. So as I'd mentioned, obesity is a very complicated disease to treat. It takes a long time. And today I'll give you the 10,000-foot kind of overview of the treatment. What I'd like you to remember is that these are just guidelines and that every person is different, and I think that every individual has different needs and at different times of their treatment course. So I would advise you to talk to your physician about what's best for you as an individual. The other thing I'd like to talk to you today is give you some tips to start you on a better journey to health. So this slide, which shows your brain, your gut, and your hunger cues, is pretty complicated. And I wanted to take a second, I promise this is the most complicated slide on this deck, but I wanted to draw your attention to some of the signaling that goes on between all the different organs in your body, representing sort of hunger and satiety. The first one I'd like you to direct your attention to is to your stomach. When you are hungry, you produce this hormone called ghrelin. It is only produced in your stomach, and it typically will go to your brain and tell you you're hungry. And I remember that it's ghrelin because ghrelin makes your stomach growl. So when your stomach growls, you're hungry and you tend to eat. Once you've eaten, food will go through your stomach and then into your large intestine. And as it's being digested in your small and large intestine, those areas will release chemical signals called incretins that get released to your brain to tell your brain, hey, there's food in the gut, stop eating. Also to your pancreas to say, hey, there's food in your gut, we need to increase the insulin production so that we can get the blood sugar under better control. Other areas of your body that are very important in the metabolism of glucose and in the satiety mechanism are your liver and your muscles. These are two organs that will take up extra glucose or sugar that you eat under the direction of insulin to help normalize your blood sugar. Now, fat tissue itself is a very active organ. And what we know is that adipose tissue or fat tissue releases a hormone called leptin. This hormone will go to your brain and tell you that you're full and that you don't need to eat very much anymore because you have enough calories in your system. I want you to try and remember some of these, and we'll come back to them because some of these are important in the way that anti-obesity medications work. So moving on to the next question that I get a lot is, why do we eat? And there are three main reasons why we eat, and I think it's important that we understand these mechanisms. The first one is homeostasis, and homeostasis basically means balance. And this is your body trying to keep everything in a normal range. Think about your temperature, your blood pressure, and your blood sugar. And when you are lacking something, so let's say you're lacking blood sugar, your body will tell you. We've all felt this before where we've been a bit shaky or you feel a bit tired, a little bit dizzy, and you know you just need to eat. Maybe you eat something and then you start feeling better. Same thing when you're cold. When you feel cold, your body kind of tells you, hey, you're cold, put on a jacket. And this is your body kind of trying to keep everything in that normal range. The second reason why we eat is a hedonic reason, and hedonic means pleasurable. And so think about sort of Thanksgiving, where you've had a nice big meal, and then someone brings your favorite apple pie with ice cream. You're not hungry. You know your blood sugar's normal, maybe even a little bit higher than normal, but you still eat it anyway. And this is because it activates the pleasure areas in your brain and releases a hormone called dopamine that makes you feel kind of very happy and very satiated. And the last reason we eat is emotional, and I think this is something that everybody can identify with. This is when we eat, maybe because we're stressed out, we're sad, we're upset, we're happy. Again, you don't need those calories. Your body has enough, but you eat because of those reasons. These reasons are important to identify because for people who are trying to lose weight, it's important to identify why we eat so that you can do something about it and eat when it's appropriate. So moving on to some of the things that I think are important for weight loss. The first one is nutrition, and nutrition is 80% of the battle. So I spend a lot of time discussing this with my patients. So the first thing I'd like to say is that diets don't work in the long run. So there are plenty of diets out there. We've all heard about them, whether they're the keto diet, the low-fat diet, any kind of diet that restricts calories will make you lose weight. Most diets are very difficult to sustain over the long term. So one of my biggest goals with my patients is to get them to eat healthy foods and listen to their body, because your body, when in balance, will tell you what it needs and when it needs it. So moving on to the next one that I think is the most important food item here is the quality of your food. And so I really like patients to focus on eating real food. And by real food, I mean foods that haven't been processed by a human being in a plant. Real foods are things that you can pick up and you can identify without an ingredient label. So think of a banana. You can pick up a banana, you know it's a banana. Pick up brown rice, you know it's brown rice. Pick up an apple, you know it's an apple. Processed foods are foods that have been taken from their original source, and typically the good stuff has kind of been stripped out, things like the fiber, the nutrients, the minerals, the vitamins, and then salt, sugar, and fat typically are added in different proportions to make the food taste good. And companies are very good at designing processed food that tastes really good, as all of us can attest to. Chips taste good, candies taste good, but those highly processed foods cause havoc to your own metabolic system because they deliver such a high punch of salt, sugar, and fat that is very easily digestible, that kind of overwhelms your system and so is hard to digest. So when you think about the food that you eat, one of the most important questions you should really be asking yourself is, am I eating real food? The more real food you eat, the more fiber, minerals, vitamins, and cancer-fighting agents you're going to be putting in your system. The more processed food you eat, the more junk you're going to be putting in your system. If you're confused about what processed foods are, look at the label of the foods that you're eating, and if there's some stuff in the ingredient list that you don't know what it is or you can't pronounce, it's been processed. Also think about some comparisons. So for instance, an apple is a real food. Apple juice that was processed in a lab, unless you've kind of made it yourself, is a processed food. An orange is a real food. Cheetos are a processed food. So think about what you're putting in your shopping cart. The next thing I wanted to talk to you about was the quality of the food that you eat. Excuse me, I need to back that up. The next thing I wanted to talk to you about was the quantity of food that you eat. We often overestimate how much food we really need and how much food we really should be eating. So when you think about your plate, I want you to think about your plate being half full with fruits and vegetables. I want you to think about getting a fistful of complex carbohydrates, and the size of a deck of cards, that should be the amount of protein that you eat. And so people will often eat much larger serving sizes of that because a lot of our food comes in serving sizes larger than that. So a serving size of meat per se is about 3 ounces, and I'm not even sure that Costco or supermarkets even sell chicken breasts that are that small. So I would advise you to measure that at home, and maybe you'll start recognizing that one chicken breast is 8 ounces or 9 ounces that you buy in the supermarket, and really that's 2 serving sizes. And once you begin to understand how much food you really need, it makes it easier to balance your plate and therefore get the right quantity and quality of food that you need. A big mistake that I see people who are trying to lose weight do is drink their calories. So typically, drinks that have a lot of calories in them include alcohol, that's a big one, sodas, which we all kind of know, but ones that we think of less are things like juices and sports drinks. And so there is a lot of sugar in juice and in sports drinks. And they're not needed for healthy growth and development of our children, and they're certainly not needed as adults. I would encourage you to look at beverages as something that you drink infrequently and in small amounts. The reason why sugar-sweetened beverages are so deadly to someone who are trying to follow a healthy diet or lose weight or balance their blood sugar is that they will give you a lot of sugar in a very quick amount of time. So if you think about drinking a can of soda, you can drink a can of soda in less than a minute if you're really thirsty. That has 10 tablespoons of sugar in it, 10 teaspoons of sugar in it. That is more than the daily total that you need. So it's very easy to get way too much sugar without even recognizing that you're getting it, because that can of soda won't make you feel full. So you're still going to go ahead and eat a big meal afterwards. So I would really encourage those of you who are trying to lose weight to really cut out those liquid calories. It's fairly easy to do. I think you need to have a plan. You need to substitute those liquid calories with other liquid calories that don't have sugar in them. We're very fortunate that we live in a time where there's lots of seltzer waters, soda waters that are flavored, that are really good without any sugar. So I would encourage you to swap out those kind of drinks for these zero sugar drinks. And I would caution you that if you do have children, or if any of your children are watching, to really not give your children any sugar sweetened beverages, because that's the #1 source of extra sugar that children are getting in this day and age. Moving on, I would definitely think about why, where, and when you are eating. So if you're trying to lose weight, you really need to figure out why you're eating, especially if you're not hungry. And this takes a little bit of discomfort. I think it's hard sometimes to look at our behaviors and habits and figure out why we do them. I would encourage you to take time, not be too hard on yourself, because a lot of our behaviors are ingrained from the time we were children. For example, maybe you were always taught that after dinner, when you watch TV, you eat popcorn. And sometimes there can be many happy memories attached with that. But doing that night after night might be very detrimental to your health. So I'd really advise you to stop and think about that and see what changes that you can make. So when we talk about weight loss, initially it's very important to track sort of how many calories that you're eating. And most weight loss specialists will tell their patients to eat roughly 1,200 to 1,500 calories if you're a woman, and if you're a man, between 1,500 and 1,800 calories a day. Now, I would say this is a good place to start, but I would like to back up and also tell you that everyone's different, and your individual needs might not fit into those numbers, and it's very important that you speak to your physician about that. Again, sometimes what works for weight loss in the beginning doesn't work so well later on. And for those people who don't like to track calories, this is where moving to a more real food diet can be very helpful, because it's very difficult to overeat real foods with large amount of calories, just because the food tends to be lower in fat, lower in sugar, again, because it hasn't been added by manufacturers. So with caloric intake, it's a good place to start, but remember, this is something that you might need to change as your journey to better health progresses. So the next thing I wanted to talk to you about for helping weight loss is sleep. And this is something that we don't really talk about very often. This is a completely underutilized treatment for health and for weight loss. So when we sleep at night, a lot of things happen in our brain and in our body. During the day, we're so busy accumulating information, putting toxins in our body, dealing with food, dealing with stress, dealing with exercise, that your body and your brain doesn't have a lot of time to kind of regroup. And this is what happens when you sleep. So at night when we sleep, your brain gets kind of cleaned out, which is great, because remember, in that one of the first slides I showed you, the brain is an active contributor to how hungry you feel. And so your brain needs rest, and that's what happens when we sleep. A lot of the trash in the brain gets taken out. It kind of resets you for the next day. And what we know is, for people who sleep less than 7 hours a night, studies have shown that your ghrelin level goes up. So ghrelin, remember, is the hunger hormone. This is a hormone that gets released by your stomach when you're hungry. And so imagine, just by changing the amount of sleep at night that you get, you can actually change how much of that hunger hormone is processed by your stomach. On the flip side, we know that the level of leptin, which is your satiety hormone, goes down. So when we've all had these nights where we didn't sleep very well, and a lot of us the next day do choose more sugary foods to quote unquote keep us awake, maybe some more caffeinated drinks with sugar in it, maybe a frappuccino because you feel like you need the caffeine or the sugar just to make it through the day. And that's a real thing. It's happening because these hunger hormones are changing in your body. So one of the things that I would really caution you, if you are trying to lose weight or just have general health, is to make sure you get at least 7 hours of sleep at night. The other thing that we know is when we sleep, we also strengthen the front part of our brain. This is called the frontal lobe. And in the frontal lobe of your brain, which sits right here, it's kind of the CEO of your body. This is the part of the brain that really helps you make good choices. And the stronger that part of your brain is, the easier it is for you to make good choices. And you're training your brain so that you're in charge of your brain and not the other way around. So again, for those of you who are looking for a small little in for better health, this is something I would strongly advise you to do. Some people need much more than 7. And if you do take that sleep, it's your body telling you it needs it and needs that rest. Moving on to the next topic that will help people manage their weight better is stress management. So one of the things that makes us eat is emotions. So the biggest emotion that we have that's related to overeating is that feeling of being stressed. And I think most of us can identify with that for sure, especially in the last 18 months. So what we know is that stress is one of the biggest triggers. What I can tell you for sure is that no one can make your stress go away. I wish we could all sort of wave a magic wand and make that go away, but that's not what happens. But what you can do is learn how to manage your stress. And what we know is people who learn how to manage their stress feel less stressed, healthier, happier, and are able to make better choices for themselves and those around them. So one of the things I'd like to invite you to do is when you feel stressed, I would invite you to stop, pause, and think. So think of it like an adult timeout. So when you're feeling really stressed, maybe someone told you something that you don't agree with, or you found out someone did something that makes you really mad, before you just react and say something that you don't mean or eat something really quickly, I would advise you to stop, pause, and think. And in those kind of 5 to 10 seconds, what happens is you can realign that frontal part of your brain to help you kind of calm down and think about a rational response. Other things that can help manage stress is exercise. So for people who exercise on a regular basis, we know that their sort of happy hormones are up. These are also known as endorphins. And we know that exercising regularly will make people feel like they're better able to deal with stress. Other coping mechanisms include meditation. This can include meditation of deep breathing, focused meditation, and it can be something as simple as taking 1 or 2 minutes, breathing in and out deeply to the count of 4, and just slowing your brain, your breath, and your heart rate down. Yoga can do the same thing. This is movement with breathing, kind of sometimes hitting 2 birds with 1 stone, kind of calming your brain and moving your body at the same time. And deep breathing, as I had mentioned. There are other countries that do things like forest bathing. This is very big in Asia, where people will just go into the forest or go out in nature. And there's something about being in nature, being outside, being in the fresh air, the sunshine, that can help calm that nervous system so you feel less stressed. And again, sleep is a very, very good supporter of stress management. Next, we're going to get to exercise. And I wanted to note that I didn't put this earlier in my slides because exercise is very important, but I think people overestimate the benefit of exercise, especially when they're trying to lose weight initially. What we do know is that exercise is very important to help keep weight off. And exercise just for general health is really, really wonderful. But specifically for weight loss, it's much more important that you focus on the foods that you eat first, and then add exercise if you're not doing that already. So the current recommendations for basic health and exercise are more than 150 minutes of moderate to intensity exercise a week, or 75 minutes of very vigorous exercise a week. So moderate exercise would be any exercise where you can still talk, but if you can sing, you're not working hard enough. Where really vigorous, intense exercise is exercise when you're doing that, you can't talk either. So if you can talk, but you can't sing, you're doing a pretty good job of doing some moderate exercise. And if you can't talk and you can't sing, you're doing very vigorous exercise, which is great. Studies have shown that for people who lose a lot of weight, to maintain that weight loss, the average number of minutes that people have to exercise is approximately 300. Again, that can change on your own individual needs, your own individual body makeup and genetic history. So when we talk about exercise, the 3 exercises that I think you should focus on the most are cardiovascular, strength training, and flexibility. I know a lot of people put a lot more stock on cardiovascular exercise for weight loss, but I would really encourage you to think a little bit differently about that. You really need all 3. So cardio would be anything which gets your heart rate up for a continuous amount of time. So think about walking fast, running, swimming, hiking, some things of that nature. Strength building exercises would be anything where you're building muscle specifically. So this would be things like using weights, bands, your own body weight. This could also mean going to a gym and using their exercise equipment. This all counts. Yoga counts for weight training as well. And what you're doing is really specifically building muscle. And the reason why this is so important when you're trying to lose weight is that your muscle, if you remember from one of my earlier slides, is really important in the regulation of blood sugar. So the better your muscle fibers are working and the stronger they are, the better you metabolize the blood sugar in your body and reduce the blood sugar that's circulating over time. So this is a really important factor in weight loss, and especially diabetic, or if you're pre-diabetic, management of blood sugar. And again, it's seen more in resistance training than it is in cardiovascular training. And lastly, flexibility. As we get older, things really tighten up, and it makes it more painful to get out of a chair, maybe get off the floor. And so this would be flexibility would be doing exercises that just work your joints in all the full range of motion. So even with your arm, you could just do exercises like this and just make sure you're moving your arm in all the ranges it's supposed to go. And this isn't very difficult. Flexibility exercises don't have to be hard. If you practice them regularly, 2 to 3 times a week, you'll be pretty flexible. This is things like touching your toes, squatting down, moving your hips in all areas that it's supposed to be moved in. You can do these exercises while you're brushing your teeth, making dinner. So I would really encourage you to add that to your exercise regimen. So we've already talked about the basis of healthy weight loss, which would include nutrition, stress management, exercise. And so I'd like to move on to medications. When you're doing those things and it's not enough, or you still have some room to improve your metabolic profile, or you feel like you still have some ways to go before you get to a healthy weight, the next step is FDA-approved anti-obesity medications. And I wanted to go through them with you. I would like to say this is, again, an overview. If you would like to try some of these medications, it's very important that you have a discussion with your physician about the appropriate medication for you, because there are some contraindications for these medications based on your medical history. So the first medication I wanted to talk about was something called phentermine. Phentermine was FDA approved in 1959, so it's been around for a really long time. And the way phentermine works, it's an appetite suppressant. It's FDA approved for 90 days, and it works pretty well. And most insurances cover it. It's very cheap. The reason why it was only approved for 90 days is because there was concern of addiction to it in the past, but it hasn't panned out. So you'll see a lot of people use it for a lot longer than that. The biggest side effects of the phentermine medication would be palpitations, meaning you might feel your heart race because it is a stimulant. It can also cause some increase in anxiety if you're an anxious person, and in some people cause insomnia. So if you do take phentermine, it's important to take it earlier in the day and get the right dosage for you to get the most bang for your buck with minimal, and hopefully no side effects at all. The next medication that's FDA approved is a medication called Kusemia. And Kusemia is a medication that is a combination of phentermine and a medication called topiramate. So topiramate has been around for a long time as well. This is a drug that is used in the treatment of prevention of migraines and also epilepsy. It has a fairly good safety profile. And together what we find is that patients feel less hungry from the phentermine, and the topiramate makes them feel more satiated. So they feel full. So if you're full, you're not looking for food and you're not eating as much. So what we find is this medication can help patients not feel so hungry, so they're less likely to overeat. The downside of this medication can be the same side effects as the phentermine, and sometimes with the topiramate, people can feel a funny taste in their mouth or some numbness in their hands in their hands at times. It's rare, but it does happen. Some patients don't mind, some patients do, so we switch medication. The next medication is called Contrave. Contrave is a combination of two medications, one called naltrexone and one called Wellbutrin. Naltrexone is a drug that we use in alcohol and drug addiction. And this medication works in the area of your brain where the addiction cycle happens. So this can be very helpful, this drug, for people who have sort of a bit of a food addiction, because it takes away that good feeling when you eat. That's the naltrexone, which works in conjunction with the Wellbutrin. The Wellbutrin is FDA approved for smoking cessation and also for the treatment of depression. And this works in the area of your brain that increases your dopamine. Now, dopamine is a hormone that makes you feel satisfied and satiated. So the higher this hormone level is, again, you feel more satiated with the food that you eat, so you're not looking for more food. So together, this medication works fairly well as well for people, especially who are, I don't want to say addicted to food, but maybe even addicted to food, but find it hard to say no if there's a cookie on the table, find it hard to walk past food. This might be a good choice for you. The next two drugs I'd like to talk about are Saxenda and Wegovi. They both are actually the same class of drugs. They're both GLP-1 agonists. They both work in the area of your brain. So remember one of the earlier slides I showed you, when you eat, your large intestine will secrete a chemical that goes to your brain that tells your brain that you have food in your intestines, so you don't need to eat so much, that you're fuller. And this is this chemical. And so these are drugs that are given by injection. The Saxenda is once daily, the Wegovi is once a week, and they work by making you feel fuller. They're also used in diabetes, and they're very well tolerated for the most part. The biggest side effect can be nausea, because it does slow down your gastric emptying, meaning that it slows down the release of food from your stomach. And people do tolerate this well, but you have to start these medications at a very low dose and then build your way up. This is a really good choice for people who have an abnormal blood sugar as well, because this also stimulates your pancreas to release insulin to lower your blood sugar. So these are choices that, again, you should speak to your doctor about to see if that's a good choice for you. The final drug I wanted to mention is called Orlistat. This is not a drug that I use very frequently, or most people use frequently, because of the side effects. So Orlistat is a drug that prevents the absorption of fat when you eat. And it's a pill that you take with your food, so 3 times a day. But unfortunately, the side effect is that if you don't absorb the fat in your gut, it comes out the other end, and it's not very nice. So people will complain that they'll have oily stools, or sometimes they'll have loose stools that they cannot control. So it's not a drug that we use very frequently. It is sold over the counter under the name of Ally at half the dose that the studies were done on. So for those of you that have tried it or are looking into trying it, again, you should talk to your doctor about it first, and then also watch out for those side effects that can happen. So those are the FDA-approved anti-obesity medications. I'd like to move on to bariatric surgery. And surgery is another treatment option About 1% of patients who are eligible for bariatric surgery actually get it. We've had a lot of success with bariatric surgery in reduction of overall death and health issues. We've shown that people who are heavy and qualify for bariatric surgery will reduce their risk of dying by 40%. And we can also reverse or improve your diabetes in just over 80% of cases for those patients with that medical disease that get bariatric surgery. So there's a few different kinds of surgeries that are out there, but I was just going to focus on the two main ones that get done. And the first one is something called a vertical sleeve gastrectomy. And as you can see in this picture, what happens in this surgery is 80% of your stomach is removed. Now, if you remember to one of my earlier slides, ghrelin is made in your stomach, and ghrelin is your hunger hormone. So what this surgery does is two things. One, it removes part of your stomach so that you produce less ghrelin, which means that you'll be less hungry. And two, it shrinks the size of your stomach so that you eat less food. So it's like a double whammy. So you eat less food and you're less hungry, so you feel satisfied eating less food. The expected weight loss is about 25 to 30%, so it's actually pretty good. And the nice thing about this surgery is that it doesn't rearrange any of your intestines in any way. So your risk of malabsorption, meaning that you're not going to absorb the vitamins and the nutrients that you need, is much lower than with the next surgery that I'm going to talk about. So the next surgery I wanted to discuss is something called the Ruiny gastric bypass. And this was the original gastric bypass surgery that came out over 2 decades ago. And the way that works, and it's pretty complicated, but you can see in the slide, the surgeon will make your stomach into this very, very tiny pouch that's really, really small. And then it will take the rest of the stomach away and the proximal or the closer part of your small intestine. And then it will attach the distal part of your intestine, so the intestine that's further down, to that small stomach pouch. And what happens is a couple of things. One, because the pouch is so small, you can't eat very much food. And two, you bypass part of the intestines where you absorb vitamins, minerals, and calories. And so because you're absorbing less calories, you lose weight. So this surgery, you can expect about a 35% weight loss, but you can also expect a higher rate of malabsorption. So we often see a higher rate of iron deficiency anemia or B12 deficiency, especially in patients who fail to take the recommended amount of vitamins after the surgery. So that was kind of an overview of the pillars of treatment for obesity. And I'd like to move on to the next slide, which is really to start talking about what you can do today to start improving your weight if you need to lose weight or improve your metabolic health. So the first thing I tell my patients is get data. A lot of people don't know their numbers. They don't know their BMI, they don't know their blood pressure, they don't know their fasting sugar, they don't know their cholesterol, and they also don't know what they're eating, where the calories are coming from, whether it's from carbohydrates, protein, or fats. And so I would advise you to get that data, because you can only make changes when you know what you need to change. And remember that 5 to 10% of body weight loss has a great impact on health. So I have a lot of patients who will say, well, I want to lose 100 pounds. And the reality is if you're 200 pounds and you drop 20 pounds and you maybe have prediabetes and some high blood pressure, you can make a really big dent in those diseases with just a 5 to 10% weight loss. So I would really recommend that you start smaller and that you have attainable goals. Because a lot of times I'll see patients make really big goals for themselves, and then when they don't get there, they kind of just throw up their hands and they just stop. And the reality is a little bit is better than none. And then find out your why. So why are you doing this? And I tell you this because losing weight requires you to change habits, and that's really hard. And it doesn't happen overnight. It takes weeks, months, sometimes years for people to really get rid of those bad habits and replace them with good ones. And it's really important to have something kind of guiding your way. And I would recommend that you picture your why in your head. So this might be you traveling when you retire. It might be you playing with your grandkids. It might be you getting off the floor without needing help. And so when you can picture this in your brain, every time you're faced with a difficult situation, because you will be, whether it's well-meaning family who are like, it's your birthday, or it's Friday, we want to celebrate with cake and wine, and that's not part of where you are right now, it's sometimes very helpful to kind of go back and picture in your mind, why am I doing this? Because it will strengthen your resolve. So really picture your why. You can write it down on a piece of paper and put it on your fridge. You can put it, I have patients that put it on their bathroom mirror. It's very helpful to remember why you're doing this, because this really is sort of a lifestyle journey. It's not something you're going to change for 3 months. If you're really serious about getting healthy, this is something that you should do for the rest of your life. So tips for better nutrition. So we already talked about this, but really focus on eating real food. Okay, you're much better off eating a banana than you are eating a weird protein bar. I know some people will say, well, the banana has more calories. Don't think about it that way. Think about what you're getting from that banana and what you're not getting from that protein bar. Use a 9-inch plate. So I say this because we're very rigged to think about food in units. So 1 unit would be 1 plate. So oftentimes when people use an 11 or 12-inch plate, we kind of fill it to the brim because we're used to that. We want to see that plate be full because that's how we feel full in our brain. So one of the ways you can kind of trick your brain is using a smaller plate. Use a smaller plate, half are fruits and veggies, this much complex carbohydrate, and then remember your protein the size of a deck of cards. Again, don't drink your calories for the most part. Okay, so if you're really starting this journey, is really get used to drinking a lot of water, maybe some herbal teas. Coffees are fine as long as you don't put a lot of sugar in them or cream, etc. We talked about making half of your plate fruits and veggies, but I will say this, eat them first. The reason why I tell you to eat them first is because the vegetables and the fruit, they're really bulky and they start stretching out your stomach. And as soon as your stomach starts to get stretched out, it's telling your brain, hey, we have food, slow down. You tend to feel more satiated earlier on and you tend to eat less. Learn how to make some basic healthy meals. Keep it simple. Figure out 1 or 2 healthy breakfasts, 2 or 3 lunches, 3 or 4 dinners that are healthy. And it doesn't have to be complicated. It could be something as simple as brown rice with some black beans out of a can and some roasted vegetables or steamed vegetables that come cut up in a bag or ready for you that you can buy in the supermarket. Top it off with some great salsa, maybe some lime and some guacamole. You have a great dinner. It's very healthy, very balanced. So keep it simple and learn how to cook, because I think that most people who don't know how to cook or make basic meals, you're really trapped into buying prepackaged food. And the vast majority of prepackaged food is processed. So you're already setting yourself up for some problems down the road. Now, the caveat here, I will say, is that for people who are trying to learn how to cook, who don't know how to cook yet, if you're eating a diet of very fast food, and a lot of fast food, a lot of soda and stuff like that, moving on to prepackaged meals, and you can buy some healthier prepackaged meals, is a good bridge, but I would recommend that for longevity and health for the next 20, 30, 40, 50 years, however long we have, you do want to be able to make some simple healthy meals on your own so you're not reliant on that. But if you need that to start your journey, do it. By all means do it. Pick good brands, research them so that you have healthy frozen options. And then lastly, when it comes to food, I recommend eating really mindfully. And what I mean by that is when you eat, just eat. Don't watch TV, don't read, don't scroll through Facebook. And the reason why I say that is because research has shown that people who eat mindfully, who really focus on their food, who are grateful for their food, eat slower, they eat less, and they feel fuller longer afterwards. So this is a life hack that doesn't cost you anything except a bit of time. And also stop eating when you're about 80% full, because remember, it does take a while for that food to make it out of your stomach into the large and small intestine. So that being said, for food, my own personal goal when it comes to food is to be like a B+, A- student. You don't need to get it right all the time. There's room for cake, there's room for a glass of wine, there's room for cookies, but these should be special occasions and they should be thoughtful. So you should know that if you are going to a birthday party on Saturday night, you want to make sure that Wednesday, Thursday, Friday, you're really getting good nutrition, and that kind of makes up for it. So if you're kind of having 1 or 2 sort of unhealthier meals per week, if your other meals, if you've had 19 healthy meals, that's not going to blow your journey at all. It's when you're having those processed, fatty, salty foods every day that your body just can't recover. And that's when the damage is done. So be kind to yourself and make sure there is room to have some of those, what we would consider unhealthier foods, but are part of living a healthy, happy life. Tips for better sleep. So set an alarm both to go to bed and wake up. And I say this because a lot of people don't think about when they need to wake up and just go to bed whenever they feel like it. The reality is if you want to have at least 7 hours of good sleep at night, you've got to train yourself to go to bed about 8 hours before you wake up. And so to do that is to set an alarm. So if you need to get up at 6, maybe you set an alarm around 9:30, 10, and this is kind of a reminder to you that it's time to kind of slow down, switch the lights off, stop working, maybe take a bath, brush your teeth, get ready for bed. You're telling your body, hey, it's time, we're going to go to sleep. I would recommend no electronics within an hour of bedtime. And the reason for that is that the blue lights off our iPads and our phones are very stimulating to our brain. And so our brain sometimes doesn't even know it's nighttime. And our brain likes to know when it's nighttime so that we can get ready to go to bed. For some people who are very sensitive to alcohol or caffeine, I would not recommend drinking alcohol. And if you're trying to lose weight, it's probably one thing you shouldn't be doing for now. Maybe down the road, once you've hit your goals or you've figured out a way to get that in your diet healthily, that's one thing. Caffeine, some people say I can't drink it at all. Some people say if it's after 2 o'clock and I drink it, I can't sleep. You'll have to figure that one out for yourself. But really, again, be thoughtful about it and think about that to see if that's impeding your sleep. So tips to get moving. So start small. So if you don't exercise, starting to exercise 3 hours a week can be very daunting. So I would say do something small, take a 5-minute walk out away from your house, come back for 5 minutes. If you're doing well with that, maybe you try adding another 5 minutes so you're 10 minutes out, 10 minutes back. Start small, build on it, but be consistent. You can't just exercise on Saturdays and expect you to have good health. So be very consistent with that. I'd rather you do 15, 20 minutes a day than 2 hours of hard exercise on a Saturday. Do something you like. So I always tell people, look, I know walking is great. Most people like to walk, but if that's not your jam, figure out something else to do. Move with friends and family. The more people you have supporting you and that are planning to go with you, the more likely you are to go. And then practice adding exercise to your day-to-day life. So this might mean parking a little bit further away, exercising before you go to work in the morning, going up and down the stairs instead of taking the lift in the office. So I'd encourage you to start looking for ways to just move more. This might even mean when you're reading something, instead of sitting down on your couch, if you're reading a recipe, stand up. And remember, when it comes to exercise, there is no shortcut. There just isn't a shortcut. All the benefits of exercise, I can't put in a pill. I wish I could, but you just don't get them that way. So please remember to move every day. And for the one thing, for those of us as we get older, exercise will reduce pain as you get older and will also increase your mobility so that you can stay independent longer as you get older. Lastly, I wanted to talk about tips on managing stress. So again, stress is a very common reason why we eat. So we need to learn how to manage stress. So one of the first things I'll ask you to do is kind of evaluate your life. Figure out what's working, what's not. Maybe you're in a job you hate. Maybe you're surrounded by people who are sabotaging your efforts to be healthier, and this is causing stress in your life. And then evaluate your response to stress. And I don't think most people ever think about it, but I would encourage you to think about, what do you do when a stressful situation comes? Do you go home? Do you go for a run? Do you eat a pint of Ben & Jerry's? Do you scream at somebody? So think about your response, because it's only if you know what your response is can you change it to a better one for you. Again, sleep. I can't emphasize that one enough. And if you need help, if you have a lot of stress and you don't even know where to start, talk to a therapist. They're trained to help you with this. And the nice thing about therapy is you never have to see these people in a sort of a family or a social situation. Exercise. Again, this boosts your happy hormones and also will strengthen that frontal lobe of your brain. And also practice stress management. And again, this might be as simple as taking a time out every time you feel stressed, doing some deep breathing, resetting yourself, and coming back a couple of minutes later on. So to stay on track, I suggest you track your data, especially in the beginning. So track your food intake so you know what you're eating. There are plenty of apps on the phone that you can get. I think nearly everyone has a smartphone now. Several apps like myfitnesspal.com or Lose It, they'll track your calories, but more importantly, they can also help you track the kinds of food that you eat so you can see how much sugar and fat you're eating every day and even calculate how much fiber that you eat. Track your weight, because if you're trying to lose weight, this is something that you want to keep track of. Now, what I will say is that some patients tell me that tracking their weight is really stressful for them. And if it is, then don't do it. If it doesn't help you, don't do it, but try it. Exercise, track your exercise. So even if you're only taking 4,000 steps a day, track it. That way you know, and you can build from that. Track your sleep. The only way you know if you're getting enough sleep is to track it. Track your stress levels and your water intake as well. So that was kind of the 10,000-foot overview of the treatment of obesity. Again, I will say this, obesity is a very complicated disease to treat. It's very multifactorial. Every person is different. These are just some tips. Try and see what works for you. Discard the things that don't work for you. Focus on the things that do work for you. And please have a discussion with your physicians, because there's a lot of treatment options out there for you. If you don't succeed and reach the goals that you set for yourself, please don't give up. Recognize that what you were doing may not work for you, and talk to a physician about other things that might be better for you. And remember that as you go on this journey, what works in the beginning doesn't always work in the middle or at the end. And so please keep an open mind. Stay conscious, stay faithful to it, stay consistent, and don't give up. Don't give up on yourself. You are able to make changes, and remember, any change that gets you even one step healthier is better than doing nothing. So at Salinas Valley Medical Clinic, we are starting up a lifestyle and metabolic program. This is a new program. Referrals can be made through a prime care physician. Please understand that this is a new program. We're starting small and growing. If you are interested, please talk to your physician about it. And we're happy to help you reach your long-term health goals so that you are around happy and healthy for a long time. Thank you for your attention today, and it's been my pleasure to do this video.
Well, we want to thank you, Dr. Oppenheim, for being here today and for this overview on the treatment of obesity. There's definitely a lot to learn. I think we've all learned a lot today, and we really
it was a lot. I was reading this and I thought, oh my gosh, it might be too much.
No, but it's great information, and I can personally say that I've learned a lot. So I'm pretty sure that all of you have. So we do appreciate your time and your expertise and your advice as well. I'm going to go home and write my why, because I want to stay healthy for the rest of my life.
Yeah, can I tell you, that's a super powerful thing, because you can bring that with you wherever you are, and you can visualize it. So you can do it when you're surrounded by 100 people, and no one knows you're doing it, and it really can strengthen your own resolve.
Right, that's great advice. We appreciate that. We do have some questions from community members, so I'm just going to read a few of them here. One person wrote, I've heard people say they are skinny fat. What does that really mean?
Okay, I'm glad someone brought that up, because one of the things I don't know if I said, but I want people to understand, is that one of the most important things that you can do is be metabolically healthy. And there are people with a BMI greater than 30 who are metabolically healthy, meaning that when you look at their lab work or their food intake or the quality of their food, they're actually doing really well. There is data to show, though, that as your BMI stays above 30 for a longer period of time, you are at risk for developing those metabolic diseases. But you can still develop metabolic diseases if you have a quote-unquote normal BMI. So there are people who will eat a lot of junk food, but genetically don't put on a lot of extra weight or don't hit that caloric requirement to gain weight, but that processed food and the unhealthy lifestyle, maybe they smoke or they don't exercise or they don't have enough muscle mass, can cause metabolic upheaval in their body, and you can still develop diabetes, fatty liver, high blood pressure, and heart disease. It's rare, it's rarer, you just don't see it as often. But there is this saying called thin on the outside and fat on the inside, or TOFI, T-O-F-I, that we see. So weight is not the only measure of health. And this is where, again, I think it's really important to know all your numbers, your blood sugar, your blood pressure, your waist circumference. So I would encourage everyone to know those numbers. And if you are one of those people with a normal BMI, but your blood sugar is up or you have a fatty liver, you need to change how you eat and how you live your life.
Okay. And speaking of body mass index, the next question is about that, and it's what's the BMI for an underweight person? Or I guess when is that going to become an issue?
Yeah, so a BMI under 18.5 is considered underweight. And so the question of is it dangerous or not has to take in a lot of other things into consideration. So let's say you are of Asian descent, where Asians tend to be smaller. And if you've always been on the smaller side and we track your growth record and you've always kind of had this low weight, but you're gaining weight appropriately and everything's functioning well in your body, I don't worry about those patients. The patients I do worry about are patients who had a higher BMI and then lose weight, either because they have a severe chronic illness, maybe a cancer, or lung disease like COPD, or they've developed a significant eating disorder, which is very, very unhealthy for your body. So I think the real crux here is that your body likes to be in this range of normal, including weight. So just as I mentioned earlier, whether it's your blood pressure, your body temperature, your glucose, your weight is one of those things too. So people will hit their kind of weight, and we typically a healthy person will go 5 pounds up, 5 pounds down, but your weight is also genetically determined, about 20%, maybe a little bit more. So we have to be really careful with underweight people. Again, if you've always kind of been underweight, but your parameters and your growth has been normal and you're healthy otherwise, I don't worry about it. If you've lost significant amount of weight and then have become underweight, that's a sign of malnutrition for multiple reasons. And that is something that needs to be worked up by your physician.
Great advice. Thank you for that. Another person here sent us the following question. For those who are very busy, perhaps traveling all the time for work and maybe only have 20 or 30 minutes every other day, what should they be focusing on? And they ask here, would it be cardio or weight training? What do you recommend?
So if you have a limited amount of time to exercise, the one thing you should focus on is intensity of your exercise. So increasing the intensity. So an example of that would be, instead of walking, you're running. For weight training, if you're doing longer reps with multiple reps with lower weight, you might want to do higher weight with a shorter amount of repetition. And so both are important. So I would just switch off. Maybe one day you have 20 minutes, you walk for 4 minutes, you run for 1 minute, you walk for 4 minutes, you run for 1 minute, and then you keep increasing the intensity as you build that up. Maybe you do a short circuit training. Here, for one of the things I like to share with my patients, there is this workout called the 7-minute workout, which you can find on an app. You can Google it. It's a great kind of high intensity exercise that you can do in 7 minutes. And if you've got another 7, do it again. But if you're short on time, the intensity counts. So remember, the intensity, you want to get up to a place where you can't talk and you can't sing for a minute or two, then bring down, come back up again. And that's how you know you have high intensity exercise. And it works very well.
Okay.
Yeah.
I'm going to have to try that. 7 minutes.
The 7-minute workout.
7-minute workout. Next question. Are overweight children more likely to become overweight adults? There is a cycle there, right?
Yeah, and I have to say, this is probably the most worrying trend that I see, is that the number of children that are carrying extra pounds is really growing. And a lot of that has to do with diet. We have a lot of prepackaged foods. Unfortunately, breakfast for kids has become dessert on a plate. Think about Pop-Tarts, certain cereals. They're easy, right? So as a working parent, look, I can't say that I didn't do that at times. You wanted something quick, but it's very detrimental for your child because they're getting more sugar than they need very early on. That's how they start their day. Their palate is now very accustomed to very sweet food. And so your child isn't going to want anything naturally sweetened because the more of that processed food the child eats, the more of that processed food the child wants. So one of the things that I really implore all of you to do is make sure meal times are sacred. Breakfast, lunch, and dinner. If your kids are in school, you don't have very much control over the lunch, but breakfast is really important. You can do something as simple as making a peanut butter and jelly sandwich. It's better than cereal. You know, take some whole wheat bread, put a little bit of peanut butter on it, a little bit of a jam, a banana, some yogurt, anything like that. Make sure your child eats healthy food, because what we're seeing is with the increase in weight is now coming an increase in fatty liver disease, diabetes. And when I trained 25 years ago, you know, for kids, the only kids that had diabetes were type 1. And now we're seeing kids with type 2 diabetes, or they're, you know, young adults. It's heartbreaking. Imagine starting your adult life already sick from a preventable disease. So this is something that I think we as a society have to really, really work on. We need to change what our children's meals looks like. We need to increase exercise in schools. As parents, we need to increase the exercise we do as a family. And we need to keep homemade meals or very healthy meals and mealtime sacred. The average mealtime in America is 18 minutes, and it's been shown that if you have more than 5 meals a week with your child, they have a lower rate of obesity and a lower rate of chronic diseases. So it's really a beautiful tool. Like, most of us don't mind sitting with our kids at dinner time, kind of sharing your day. And if the average meal is only 18 minutes long, we can do that.
We can. There's absolutely no
Yeah.
excuse.
Yeah.
And who doesn't love a peanut butter and jelly sandwich?
It's my favorite go-to.
I prefer the grape jelly. I don't know about you.
No, raspberry.
Raspberry, okay. Raspberry and peanut grape here. Intermittent fasting, is that effective?
Yeah, intermittent fasting is a very effective way to lose weight. There are various forms of intermittent fasting, and the benefit of intermittent fasting, and they're still doing a lot of studies on this, but it's not just weight loss, but can also help with longevity, kind of reducing insulin resistance for those people with blood sugar abnormalities, and reducing weight kind of in the central part of our body. There is no difference in weight loss between intermittent fasting and those people that do a reduced calories. So these are people that will reduce their amount of calories through 3 or 4 meals over the day. The reason why intermittent fasting works for some people is they don't like to count calories. And that's a really good option for you then, because what we find is if you only have an 8-hour eating window a day, it's really hard to overeat versus a 16-hour eating window a day, which is what a lot of people do. They start eating at 7, they snack, and they go to bed at 10, so they're eating, you know, all day long. So intermittent fasting can be very effective. Again, it takes a little bit of discipline, because, you know, if your eating window is 11 a.m. to 7 p.m. and you're hungry at 9, you have to have the ability to kind of sit with that hunger and say, okay, wait a minute, I know what's happening here, I need to wait 2 more hours. And the way intermittent fasting works is that over time, When you're eating, you are burning the sugar, the glucose that you eat. And after a meal, you're probably burning it for about up to 6 hours afterwards. So if you're intermittent fasting and eating for 8 hours, you have a 16-hour window where you're not eating. So you'll have an 8 to 10-hour window there where you're not burning sugar anymore. And the idea is that you're burning fat. So your body changes the fuel that it's using. And that can be actually very helpful for some people. It can be very helpful for menopausal women as well. So I tell people the only way you're going to know if it works for you is to try it. It might work for your best friend, might not work for you, might work for you, might not work for other people. And again, it's an option. It's another tool that people have to try.
Okay. Thank you for that. And we have one final question here, and it's what are the long-term impacts of doing the keto diet?
Okay, keto diet.
Keto diet.
Not my favorite diet, but, so let me just back up a little bit. So the keto diet is a diet which is a very low carbohydrate diet and high in fat. There is some data showing that it can help with epilepsy in children, but we're talking about weight loss. When you take away that carbohydrate, which is our main fuel source, and substitute it with a lot of fat, your insulin resistance does go down. And so people generally do lose a lot of weight. I find that it's very unsustainable long-term, meaning month after month, year after year, because our main fuel source is carbohydrate. And when you look at the healthiest people in the world, they do eat a significant portion of healthy, complex carbohydrates, some protein and some fat. The problem with the keto diet that I have seen, my biggest lab abnormality that I have seen is very elevated cholesterol. So again, this goes to the fact that you might be thinner or you might weigh less, but now your risk of heart disease has gone up. And so again, one of the most important things I think for anyone who's watching this, who is trying to lose weight or just wants to be healthier, it's really about long-term habits that you can do now well into your 70s and 80s that are going to keep you healthy. So some people will say to me, well, I need to do something drastic just to get started. And I'm like, okay, that's fine as long as you understand that there's no data showing that this is a long-term viable option. So some people will say, some people really will disagree with me, but I don't have a patient ever in 20 years that has managed to stay on the keto diet for more than a few months. Again, they like the way it makes them feel. For diabetics, it can really drop their blood sugar. But again, I would encourage you to learn how to eat in a way that's correct for you, getting the right kind of real food nutrition balanced with the right amount of sleep, the right amount of activity, and the right amount of rest.
Great advice. Appreciate that. Thank you so much.
You're welcome.
For answering those questions and for this presentation. Before we wrap things up, next month our Ask the Experts virtual presentation will be right here on Facebook. It will focus on breast cancer. You can tune in on Wednesday, October 20th at 6:30 p.m. For the English language presentation. As for the Spanish language presentation, that will take place the week after on Wednesday, October 27th, also at 6:30 p.m. right here on the hospital's Facebook page. Dr. Oppenheim, thank you so much for being here today.
Thank you for having me.
You really have provided very valuable information. We can all take this information home to our families and start practicing what you have shared with us today.
I hope so.
We do too. And we look forward to having you here sometime, hopefully in the next few months. There's a lot more to cover, so we do look forward to that.
Thank you again.
Thank you. And thank you all. We really appreciate you tuning in and for sending us these questions. We'll see you next month. Take care.